All right, we ready?
Yes.
Thank you for joining me on this Friday evening to discuss gonorrhea. Y'all are the real MVPs. All right, we're going to start with vaginal infections. These are not all sexually transmitted. It's just you got some infections up in the vag. Okay. The only one on here that is really truly sexually transmitted is trick.
Okay.
Tricks on you. Nope. All right. So we're going to start with bacterial vaginosis, which basically just means
Bacteria.
Yeah, you got too much. Now, we always have bacteria in the vagina. That's normal. But this is an overgrowth of bacteria to the point where it actually causes infection. Now, if you look over here at these letters, this will tell you what it is because these are highly testable. So the B is a
Bacteria.
The F is a fungus. The P is a
Parasite.
protozoa.
Oh.
Hopefully there's not, if there's a parasite in your vag, I would absolutely die. That is one of the worst things I could ever imagine. Okay. So we're going to start with BV, overgrowth of bacteria. It is from Haemophilus gardnerella. Ugh. Okay. Now they're going to ask a lot about discharges. Like, what does it smell like? What does it look like? So make sure that you note the adjectives and the characteristics of those, and then know if it's sexually transmitted or not sexually transmitted. That's important to note too. So BV is not usually sexually transmitted. I mean, could it be if it was like really dirty? Okay, maybe. But it's just because there was an overgrowth of bacteria, or you messed with the pH, you messed with your the whole microbiome down there. Okay. Fishy odor, that is off-putting. Okay. It literally smells like dead fish. And what? Yep, not your best day, especially after sex. Not sexy. Okay. And that's because it's like stirring up all the bacteria during sexual activity, and so it lets off this fishy odor. Profuse, thin, white gray discharge. Hey girl, how you doing? Welcome to BV. So it's very like almost watery-ish, but there's a lot of it. So watery gray fish. Got it?
Got it.
Okay, they may have some irritation down there, and that's only because that discharge is basically like, sitting on the vulva. And it may itch a little bit. Most people just say like it kind of hurts or burns. Like I said, it can be sexually transmitted, but usually you just did too much. You did too much. Y'all know you're not supposed to douche. You're not supposed to use deodorant. You're not supposed to do any of those things down there. Okay. It's a self-cleaner. It will clean itself if you just let it be. All right. So complications, what can this cause? Well, we haven't really had many sessions, so you wouldn't know this, but any infection can cause preterm labor in mom because it tells the baby
Something's
wrong, and I probably ought to get out of here. So every time moms come in for their OB visits, they are going to have to pee in a cup, and we are looking for a UTI. Something as simple as a UTI can cause preterm labor. All right. And mom may be, 20 weeks along, and there you have it. Okay. So any of these infections that we talk about today can cause preterm labor in a pregnant mom. Okay. Somebody once asked me, what if they're not pregnant? Then there would not be preterm birth because there's nothing to birth. Okay. Early ROM. What's ROM?
Rupture of membranes.
Rupture of membranes, right? Which would cause a preterm birth. Because once the membranes rupture, you got 24 hours to get that baby out. That's it. Okay. Because there's already so much bacteria. And once you open up the cervix, because the water broke, right? And it's just open to the baby, you've got to get that baby out. Postpartum endometritis. What is endometritis?
Inflammation of the endothelium of the uterus.
Of the endometrium, right? Which is the inside of the uterus. Because you've just given birth, so everything is open. So whatever's in the vagina can just go straight up into the endometrium and cause postpartum endometritis. Intraamniotic infection. So again, if she's pregnant, it can travel, even if she is not given birth, even if we're not preterm birth, it can still go through the cervix and cause an infection in baby. That will eventually cause preterm labor because the baby knows I got to get out of here. It doesn't want to breathe in your BV. Okay. All right. Diagnosis. We do something called a KOH test. Okay. And this is super weird. I'm actually going to show you all these different things. If y'all can't see it, tell me, because I'm on my laptop and I'm not as good on a laptop. But these tests we can do at OB. Okay. Oh, I've already looked it up. Look at that. And they can do them like right there in the office. Okay. So what they'll do is they this is so gross. This is what it looks like. Look.
Okay.
She said, thank you for sharing. You may now get off this page. Okay. So they will do what's called a wet prep. Have you ever heard of a wet prep?
No.
Okay.
No.
So they've probably done it on you whenever you went in for your well woman visit. You just didn't know because they were already up in there for your pap smear. Okay. So this is what they basically will just take some junk from in there and then they put it on a little microscope and then they're going to add some chemicals to it. Then when they add the chemicals to it, they go like this and smell it. And if it smells like straight up fish, then it's BV. B&OB, they said. When they look at it underneath a microscope, this is highly testable. You will see what is called clue cells. Clue cells are diagnostic for bacterial vaginosis. Okay. You can see the bacteria has attached itself here to the epithelial cells. Okay. There is something, I don't know if I put this on your chart or not, because I can't see it right now, but there is something called the Amsel criteria. I mean, basically you can smell it, y'all. There's no way you're going to need to go through all of this, but just to let you know, to definitively diagnose, you have to meet 3 of the 4 criteria, which include the thin, white or gray, homogeneous discharge, which means it all kind of looks the same. They have clue cells under the microscope. Their pH is greater than 4.5, because what happened was the pH of the vagina is usually what? It's acidic down there, right? So if their pH goes too high, which the pH can go too high because you douched or you use stuff down there, you use a lot of like Bath and Body Works, that's like super toxic. It can change your pH and allow bacteria to grow because there's no longer acid down there to kill it. Okay.
Oh.
And a fishy odor to the vaginal discharge. Okay. So what you're going to do is you do the wet prep, you add this 10% KOH, which is the chemical, and then you whiff or smell. And you're, do you understand?
Yeah.
That's BV. Okay.
Okay.
So gross. All right. Now that is okay. So a wet prep is when you're testing multiple things. So the wet prep will test for things like bacterial vaginosis, candidiasis. So the wet prep tests for multiple things. When you're doing a wet prep, you will do the KOH and see the clue cells. Does that make sense?
Yes.
Okay. Then you can also use what's called nitrazine paper. This will come into play later in OB2 because we use it to determine if moms are in preterm labor, but you can do the pH of the vaginal fluid and it will be greater than 4.5. Okay.
Okay.
All right. Treatment. Here's our friend metronidazole. What was the big thing you needed to know about metronidazole?
That it can cause preterm labor.
Metronidazole, the drug.
Oh,
Damn. Okay.
Isn't that with hypothyroidism?
That's methimazole.
All right, almost.
Okay. Okay.
Is
I don't
that the
remember
one
metronidazole. This was
Is that
in
the one
antibiotic market.
antibiotic? The
It's like an
antibiotic?
anti-infective. Okay,
Okay,
it's an azole, so it's like kind of like sort of fungal, sort of anti-infective. It does sort of both. But the big thing was it causes a disulfiram-like effect.
Oh,
So
yeah.
you have to teach them, do not drink alcohol. Okay. You can also use clindamycin cream since it is a bacteria. It just is not, I don't feel like it's as effective, but it is an option. Okay.
Okay.
There's no partner treatment required because it's in your vagina. Okay. And it can't, that's it. Okay. No, no breastfeeding if you're on metronidazole because it does go through the breast milk. Okay. So if you're a breastfeeding mom, then obviously clindamycin cream would be your option. Teach proper hygiene, which includes what?
wipe front to back.
Okay, that's fine, but wash it just with water. That's it, right? Don't douche, don't use deodorants, don't put smelly things down there. Like you are not meant to smell like a candy cane down there. I don't know what people are doing. Okay. It just cleans itself. Leave it alone. Okay. Because when you start putting too many products down there and messing with it, you're going to mess up your pH and then you're going to start getting all of this stuff. Got it?
Got it.
Okay. Next is candidiasis, which is what?
Yeast infection.
Yeast infection. Very, very common, not sexually transmitted, right? Right. All right. Signs and symptoms, vulvar pruritus. So it's itching on the vulva, which is the outside part, right?
Right.
All the way to like the inside lips too. Okay. They may feel like there's vaginal dryness or just kind of irritation. And then because they itch, they will get excoriations down there. Now you can get secondary and like bacterial infections from itching down there. What is dysuria? Y'all know it kind of burns when they pee, but that's not because there's a problem with the bladder. It's because that acidic urine hits those excoriations and then it hurts like hell when they pee.
Right.
Understand?
Mm-hmm.
Okay. The discharge is thick, lumpy, cottage cheese like discharge. Have y'all eaten dinner yet?
No.
well, you're gonna have to wait a while. A lot of this is gonna be food related, and you're gonna be like, I don't want that anymore. Yeah, take a big old spoon of cottage cheese and see how that feels. All right, transmission. If they have multiple rounds of antibiotics, why would that lead to a yeast infection?
Because it kills the normal flora.
Yeah, it does. Remember, you're self-cleaning down there, but when you mess with that flora, that's gonna happen. What about diabetes?
Lots of sugar in the blood
Lots
and
of
bacteria.
sugar. It's going to be lots of sugar down there too. Remember, we've diagnosed patients with diabetes just off frequent yeast infections. Yeah. That's the same thing for the high sugar diet. What about corticosteroids? Why would that cause yeast infections?
It depresses your immune system.
Yes. Plus, what else does corticosteroids do? What else do they do? What do they do to your sugar?
Oh, increases it.
Right. So it increases your sugar, right? Causes hyperglycemia, plus it decreases your immune system. If patients are immunocompromised, obviously, grody things are going to grow. There are really no complications from it. It's really just more annoying and uncomfortable than anything. We will do, again, a wet prep. That's a yeast infection or candidiasis is one of the things that's included on the wet prep. We will do the nitrazine paper, but it's going to be a normal pH because it doesn't change your pH. But you will see what's called pseudo-hypha. I think that's a weird thing to say. Let me see if I can show this to you. Pseudo-hypha. All right. Okay. So this whole thing actually is going to be like yeasty, but you can see like hyphae are like the extra things that are coming out here. And you'll see that right here. You can see all of this on the microscope. So that's what we're doing a wet prep for, is to look underneath the microscope and see what we see growing. So if you see pseudohyphae, that is a candidiasis infection. If you see clue cells, that is
BV.
BV. That's really. All right. So our treatment are going to be our azoles, Avi. Now you can do this lots of different ways. They can do it like topically if it's really a very mild infection. If it's a really bad one, you have to do the vaginal applicators. Do you know how to use those? I think we talked about those last time.
It's like a suppository for the.
There is a suppository. There's a vaginal suppository that looks like a little egg, right? That goes in an applicator, but there are some that already come like filled with cream and you just apply it like a tampon and then just squeeze the end of it, like push the end of it in like a syringe. Yep. And so we'll do that. But some of these are very strong. Like you can get them over the counter. Some of them are 7 days, which is what it's supposed to be. But some people, because it's very messy, first of all, apply it at nighttime, because if you apply it first thing in the morning and then you get up, it's just going to be all in your panties and it's very gross. So we tell patients to do it at nighttime, then you're sleeping and it'll stay inside. There's something else going to tell you. Where was I going with this? I was saying something else before. What was it?
But it's strong.
Oh, yes. So there are ones that come, thank you very much, as a 3-day treatment and a 1-day treatment. So the percentage gets stronger. Some patients that get the 1-day treatment, I mean, it's like a potent amount and it can burn the inside of the vagina. So you just got to be really careful. If you're very sensitive down there, which a lot of people are, just go ahead and do the full 7 days. Okay. So the cream that's in those applicators is meconazole, or most likely it's clotrimazole. Okay. We want to add probiotics. How come?
Because of the bacteria.
All right, so it's going to give you good bacteria back. And then garlic is actually a very good natural remedy. You can crush the garlic. You can add it to like some kind of medium, like I'd usually water it down or put it in some coconut oil. And you can put it, it looks like a little cheesecloth, and you stick it up in there and let it sit and it'll be gone in a day. Yeah. There are other natural treatments too, like apple cider vinegar is very good at doing that. You'll dip a tampon in watered down apple cider vinegar, put it in at nighttime, and then take it out the next day and keep doing that until it goes away. Okay. It's better than burning the inside of your vag,
Right.
Please make sure you water it down, because straight up apple cider vinegar in your vag is going to burn too. All right. So for nursing care, we are going to do sitz baths. What are sitz baths?
Is it room temperature?
Yes, but you like kind of squat and you like splash it up on your pee-pee. Okay. Oatmeal baths. So they can just sit in like lukewarm water, and y'all know they have those little Vino oatmeal bath things you can put in there in the bath. Or baking soda baths can be helpful too. Tell them to go without underwear if at all possible, especially at nighttime, just to let things kind of air out, because yeast likes warm, moist environments. So if you can like let it air out, do its thing. They are not supposed to wear tampons until this is treated, because you're basically just keep pushing the yeast back up in there. If people get a lot of yeast infections, I always tell them to get organic tampons, because there are a lot of chemicals in regular cotton tampons, which can be very irritating. No intercourse until it's cleared, only because it's very painful. You can't really, I mean, you actually could pass it to a dude. It's very uncommon, but it's very messy and very painful for them to have sex. So it's better to just wait. But their partner does not need to be treated unless they break out in some kind of yeast rash. Okay.
Got it.
All right. The trick. There's a lot of jokes about the trick. So this is the P is for
Protozoa.
protozoa. Now I keep having parasite in my mind. You said that. Your friend said parasite and I am dead. Okay, Elena, that's what happened. So the cause is Trichomonas vaginalis. It literally tells you like what it is. Now this one has yellow, green, frothy discharge. A lot of it, and it does not smell good. Okay. There is a lot of irritation, a lot of itching. It burns when they pee because there is irritation on the outside as well. What is dyspareunia?
It hurts during intercourse. Is that one?
That is a very nice way to say it as well. Yes, that is pain during intercourse, which any of these are probably going to be uncomfortable, right? Because everything's irritated. And then this is one of the STDs that you will see strawberry spots on the cervix. Let me see if I can show you this. It's not the only one that does this, so just so you know. But the cervix will look like this.
Oh, wow.
This is a cervix, not the end of a penis, just so you know.
Yeah.
Or this, I know it kind of looks like it, doesn't it? Oh, here's the what the discharge looks like.
Ew.
Wow.
Yeah, it's not good, y'all. It is not good. This is very, very messy, but y'all can see what the strawberry spots look like.
Mhm.
Yeah, this is looking at a cervix. And you can tell if somebody has had a baby or not, right? That one's
Yeah.
been opened, obviously. Okay. All right. Do we understand what it looks like?
Yes.
You're like, yes, please get off the screen. Thank you. All right. It is sexually transmitted. It doesn't cause any complications really, but it is pretty, ugh, okay. Now any of these, can end up going into PID. Do you know what PID is?
Pelvic inflammatory disease.
Yes. And that's where it's going to spread up into the pelvis, and they get like, it almost looks like sepsis, like super high fever, chills, nausea, vomiting. They are very acutely ill. So any of these can lead to that. Okay. So again, we're going to do the wet prep. Okay. So you can see the wet prep is going to test for which three things?
EV,
Bacterial vaginosis,
candidiasis,
candidiasis,
and
and trichomonas.
trichomonas.
Okay. Y'all probably had this done a million times. You just didn't even know it, because while they're in there, like I said, for the PAP, they'll just go ahead and do it. So our treatment is going to be either metronidazole, which again, no alcohol, right? No breastfeeding, or tinidazole. Those are both kind of antifungal, anti-infectives. You need to test for all STIs, because if you do have trichomonas, it puts you more at risk for getting the other STDs. So you need to test for all of them. So like if, let's say someone comes in for their well woman visit, I do a pelvic, I do a PAP, I did the wet prep, and I find they have trick, I'm going to do chlamydia, gonorrhea, like all of those other ones to make sure that there's nothing else I need to treat. You do need to treat the partner, because it is very contagious and the partner probably has it and will be spreading it to other people if they have other partners. This may be asymptomatic. They may not even know that they have it, which is why they do the wet prep every year when you come in for your well woman visit.
Okay.
With me?
Yes.
Okay. I wish I could make this thing go away. I don't know. It's kind of annoying. Let me see if I can. Nope. Okay, everything's fine. No, it just. Oh, okay. All right, group B strep. So we talked in PD about group A strep, right? That was strep throat. This is group B strep, so it's very different. Group B strep usually will happen to pregnant mothers towards the end of their term pregnancies. It can exist in their bottom. It can also exist in the vagina. So we test every mom when she gets close to labor for group B strep by doing either a rectal swab or a vaginal swab. And what they used to do is they used to treat the baby too all the time. That means a baby would have to go to NICU and they have to get an IV started and they have to get 2 days of antibiotics. And they were like, that's kind of silly. Why don't we just treat mom during labor, and that should prevent baby from getting it? So that's what we do now. Okay.
Okay.
So signs and symptoms, mom may have fever. She may go into preterm birth. The rupture membranes may happen earlier. She is most at risk if the rupture of membranes is over 18 hours. That's why I told y'all, how long do you have once she breaks her water?
24 hours.
You got 24 hours to get that baby out, because the risk of infection is super high, but group B strep starts increasing your risk at around 18 hours.
Okay.
It is transmitted, it's contact precautions, right? If they have group B strep, because it's strep, y'all should know that. Complications would be preterm birth, neonatal sepsis. So if mom didn't get treated, then the baby can get group B strep, because like I said, it exists in the vagina and or the rectum. So especially if there's a vaginal birth and baby goes to the birth canal and there's group B strep in there, that's where you'll see it. Okay. And it can be a pretty ugly infection if we don't treat it. So it's really, really important. Do y'all remember that this was one of the leading causes of some disease in neonates that I taught you in PD?
Was it cautious curse?
Was it what?
The K cardiac one?
No. This is
Okay.
like a transmissible, like a contagious disease.
Oh, Fitz disease.
That's a virus.
Okay.
Okay.
Pneumonia,
No.
meningitis.
Yes.
Okay.
Yeah. So group B strep is the leading cause of neonatal meningitis, and meningitis in little bitty babies is really bad. So we want to make sure we treat mom. So we will do a screening at 35 to 37 weeks gestation. They can either do a rectal culture, vaginal culture, or some hospitals will do both. Okay. And then if mom has it, she will go on IV antibiotic prophylaxis as soon as she starts to labor. They'll give either penicillin G or ampicillin. And then if that happens, you usually don't have to treat baby, which is really nice, because then
Okay.
baby can just go with mama. Monitor temps and moms. So if any moms spike a temp, we want to make sure that group B strep has been done. And they call it GBS, and you'll hear that all the time in the OB unit. Your brain's going to think Guillain-Barré. So don't walk into the room of the mom and be like, is she paralyzed? How's she going to labor? No, it's group B strep. Okay.
Yes.
All right. Do we understand the vaginal infections?
Yes.
Y'all make these Zoom sessions so easy. Y'all like Zoom or not really?
Yeah, sometimes.
Fine. Okay. Not always. Sometimes. Okay. Let me see where I want to go. Okay. I had this at 175 because I'm blind. Okay. This is kind of your cheat sheet, and then we'll go into the actually like sexually transmitted diseases. So y'all should know primary and secondary prevention. Yes. Okay.
Yes.
So give me an example of primary prevention for STIs.
Abstinence.
Okay, you go with your bad self. But what's a other one? Yes, you are right.
Condoms.
Yeah.
Okay, so that would be like from a nurse standpoint, that would be handing out condoms at, I don't know, probably a high school or a college or something. Secondary would be
Screening.
Screening.
right. So going to your yearly well woman exams and getting your STD screenings yearly. Yeah.
Yeah.
Okay. All right. Things you need to do if you are a nurse that is responsible for decreasing the STD rate, which they have nurses whose that is their job.
Okay.
What a day to be alive. So public health, I say Texas, but every state has their own Department of Health, and STDs, most of them are reportable if they are really transmissible. So when you have a patient that has a positive STD, you have to call the health department and say, I got somebody with gonorrhea, and they mark it. And then they start tracking where all these STDs are happening. If there's an area where there's a lot of STDs, they will send a nurse out there to go and do education in that community and hand out condoms and do safe sex things. And it's wild. Okay. So just know if you get an STD, somebody, we call them the Department of Health on you. Okay. But I did write that on the charts, which ones are reportable and which ones are not, because that is very likely to be on ATI and NCLEX.
Okay.
Okay. So things you need to do. Conduct an STI or HIV risk assessment. So questions you're going to ask that people will probably lie to you. Okay. So just know that whatever they report to you is probably about half of what actually is true. Right. Do you know what I mean? Like when you ask how many partners, they're hardly ever going to tell you. Now the dudes will increase theirs by 50% and the girls will decrease theirs by 50%. Okay. So you want to ask if they're sexually active, but you have to be careful with this. You have to ask it. You can't say, are you sexually active? Because some people don't know what that means.
Mm-hmm.
Okay. Like they would ask high schoolers and they'd be like, no, I just lay there. No, what I mean is, okay. So you have to ask, like, are you having sex with other people, or are you in a sexual relationship with someone? Yes or no? Yes. Okay. Is it with boys, girls, or both? You always want to ask that because you can't assume, right? Because we're going to screen for different things depending on who their partners are, right? And then you have to ask them what type of sexual activity, because some people they only consider like penetration intercourse as sex, right? Or sexual activity. So there are a lot of other issues that go along with any sexual activity. Like people don't know you can get STDs in your throat. So if all you're doing is oral sex, I still need to know that because that's still considered sex. And I need to be able to swab your throat and make sure that there are no STDs in your throat. Okay. Because STDs, y'all know they can travel in all kinds of weird places, right? Like, it's not common to get a UTI with strep A, right? Like strep is not very common. UTIs, it's usually like E. coli or Klebsiella, something like that, right? So when you have infections like that, you have to find out what happened. So did I tell you all this story about what happened when I was working in adult clinic?
Mm-mm.
There was a husband, I could have sworn I told you all this. There was a husband and a wife that came to the clinic. They always come to the clinic. They were just patients there. And we all knew them very well. And the dude came in and was like, it's burning when I pee. And we're like, anytime a dude comes in with burning when you pee, it's like, what? Because it's not common for men to get UTIs, right?
Mhm.
So we tested the urine because he said, like, I've been married, you don't need to test for STDs or whatever. And his urine grew strep A. And we're like, strep A? That's weird. Because where do you get strep A?
Your throat.
Oh. So come to find out, this lady comes in the next day, not his wife, and she had strep throat.
Wow.
But the phone number that she gave was the same phone number. I should say not similar. It was the same phone number as the dude we saw the day before that was married. So what had happened was the girlfriend got strep throat, and then she performed oral sex on this man, and then he got a strep infection in his bladder. So you got to kind of track it down sometimes and find out, because these things can spread in weird places. All right. Other questions you want to ask is how many partners have they had? And then you always want to ask boys, girls, or both, just so you maintain non-judgmental status. Okay. Have they ever had an STI before? And then you always want to ask about abuse, but you can't say, have you ever been sexually abused? Because some people, things have happened to their body that they don't consider sexually abused, even though it actually is, right? So what's a question that you want to ask here?
Like what age were you when you first had sex?
No, to find out if they were been abused.
Did you?
Oh, is that what you were answering? My bad. What?
Yeah.
But you'll know sexual abuse can happen at any age, right?
Right.
So what's a question you want to ask?
Could we ask like a consent type of question? Like, was there ever an instance where you didn't give consent, or I don't know, that's the right route to go down?
Yes, I absolutely agree with you. I would say it like, has anybody ever done anything to your body that you did not like or you did not think was okay?
Okay.
Okay. Because sometimes people will give consent even though they don't mean it because they're scared. So I just want to know, has anybody ever touched your body in a way that you did not like or that you did not think was okay? Now, sometimes you'll get some random weird answers because they didn't understand what you were saying, but that's like the best generic question that you can ask to see what comes up. Yeah.
Okay.
All right. I want to know, are they on contraception? Do they want contraception? And then what are they doing to prevent STDs? Now, a lot of people ask, what are you doing to prevent pregnancy? But they don't realize you have to do contraception and STD prevention because birth control does not prevent STDs.
Right.
Yeah. So you want to ask both. Why do I want to ask their drug history?
Needles.
Okay, that's fair. Why else?
That's what I was thinking. Could it make you more susceptible to STIs if you're on drugs?
Yes, because you typically engage in more risky behavior when you're under the influence.
Okay.
Okay. Sorry, just choked for no reason whatsoever. All right. Have you ever gotten a blood transfusion, a tattoo, or a piercing? What am I looking for?
HIV.
HIV and
Hepatitis A.
hepatitis. Okay.
All right.
HIV and AIDS testing history. When are you supposed to get tested?
Yearly.
Every year when you go in for your well woman exam. And sometimes you have to ask for it. They may not always do it. And I don't care how committed in a relationship you are, everybody ought to have this done every single year. Okay. All right, the other thing that you want to do is counseling regarding prevention methods. So you need to talk to them about female condoms or male condoms. What's best for them? Maybe abstinence. I don't know. What is mutual monogamy?
It's staying in your like one relationship, like one person.
Yeah,
Yes.
both partners.
Both partners
Well,
agree that the
yeah.
other person, like that other person is the only person that they're having sex with. Now, this doesn't always work, but it is something you want to talk about. All right. Have they had the HPV vaccine? Okay. And the hepatitis A and B vaccine. I'm not even going there, but you understand what I'm trying to do here. Okay.
Yeah.
So in order to prevent STDs or to prevent your risk, you want the least amount of sexual partners, okay, the least amount of exposure to body fluids, low risk sex. What is low risk sex? Sorry. I'm so immature. I'm so sorry.
I don't know, like,
Like
straight to the
not-
point, nothing crazy,
Yeah.
What?
like conventional, nothing
No,
off the
it's
box.
not intercourse.
Oh,
Like if you get STDs from like switching body fluids and you don't want to switch body fluids. So low risk sex would be things like mutual masturbation,
okay.
pleasuring somebody with your hand. Because you can't get an STD that way, really, right? So low risk sex is participating in sexual activity that would give you the lowest risk of actually getting a sexually transmitted disease.
Okay.
Okay, and people will tell you some stories. I'm embarrassed to say it. Okay, so this girl was in a relationship with her boyfriend and they've been dating for quite some time. And she went to a party without him because he was working. And she came home like in the middle of the night. She was drunk, whatever, that happened. She comes into clinic and she's like, I think I like something's going on because it's like uncomfortable down there, whatever. So come to find out she had chlamydia and her boyfriend obviously didn't. And so she's like, what am I going to tell him? Like what? And I was like, girl, I don't know. What did you do? You know, like you have to tell him whatever. And she's like, no, this is what happened. So I think that there was a guy at the party that had it. And like, he probably got some of his body fluids, like on his jeans. Cause all I did was like rub my privates on the outside of his jeans. Man, what? You tell that story and see what happens. That's kind of like getting HIV from the toilet seat, but okay. You need to talk to them about getting their partner tested and their partner history. It is very important when you get a new sexual partner to make sure you ask them when was the last time you were tested for STDs. And I don't care how much time it has been, I'd get them tested again. Because, you could go and get tested for chlamydia, gonorrhea, and then go out the next weekend and get it, right? So if you care about yourself, even though it's uncomfortable, you want to ask and make sure that they get that STD screening done. Okay.
Yes.
Because STDs can lead to pelvic inflammatory disease, which then scars the fallopian tubes and can lead to permanent infertility. And as you're about to see, a lot of these STDs do not have signs and symptoms. So you could be asymptomatic for a long period of time. Meanwhile, it's just like eating away your fallopian tubes.
Wow.
Yeah. So it's very important to take care of that's just to take care of yourself. And if he's not willing to do it, then he's really not a good partner, right? As far as condom counseling, we want to make sure we use latex base unless they're allergic to latex, then please don't do that. Okay. Do not expose them to heat. Check the expiration date. Use a condom every time. You have to tell people you cannot reuse them. They're not multiple use. That's disgusting. Okay. Please remember spermicide can wear down the condoms and you have to use what type of lubricant?
Water soluble.
Yeah. Yes. Because if you use spermicide, it can wear down the condoms, increase your risk of HIV. We talked about that the other day. Yeah.
Yeah.
All right. Questions on your cheat sheet?
No.
Cool. Are we having a good time?
Yes.
That's good. Me too.
Hmm.
Okay. Oop, might need to make it a little bigger or get my glasses, one of the two. Okay. So we are going to start with chlamydia. What type of disease is this?
Bacteria.
Bacteria. I could have sworn one of y'all were going to say sexually transmitted and I was just going to die. All right. So chlamydia is I put number one, not like, cause it's like, you're number one. It is the number one STD, and chlamydia and gonorrhea almost always coexist together. So much so that when we order screening, we order a GC. Gonorrhea, chlamydia. It comes together because if one's positive, chances are the other one is. If one of them is positive, I'm treating them for the other one anyway because they coexist so often. Chlamydia is caused by a bacteria called Chlamydia trachomatis. Be careful of this on the exam because it looks like trichomonas.
Yeah.
Okay. So they may not put the chlamydia part. They may just put trachomatis and make sure that you're choosing it correctly.
Okay.
It is a gram-negative bacteria, so that will help you understand what we're going to treat with. Signs and symptoms. Most of the time, it is asymptomatic. Okay, they have no symptoms whatsoever, and it can end up causing PID and infertility, and you didn't even really know it at first. What is urethritis?
Inflammation of the urethra.
Yes, and that usually happens in boys. So it'll burn when they pee. Like I said, anytime it burns when a dude pees, you do not have a UTI. You probably have an STD. Okay. What is proctitis?
Inflammation of the
Of the proct? Oh, yeah, of the proct. You know. What's a proctologist?
the rectum.
A butthole doctor. So they can have, inflammation of the rectum, because you know you can get chlamydia or gonorrhea in the rectum as well if you are having anal sex. Okay. Epididymitis.
Oh, inflammation of the epididymis.
Penis?
What is the epididymis?
Isn't that like one of the tubule things?
Mm-hmm.
Is that where the sperm travels?
It is.
To the
Where it
urethra.
goes to the vas deferens, which is another
Vas
tubule. Yeah.
Okay.
All right. Cervicitis.
Inflammation of the cervix.
Cervix inflammation.
Okay. They may have discharge. When you touch the cervix, like if you go to do a pap and they have chlamydia, it will immediately start bleeding. The tissue is very friable and very tender. Bartholinitis. You know, I have to show you all this because this is just the most wildest thing. Okay. You should know where the Bartholin glands are if I gave you the big giant picture of the vagina. But let me show you all this. Oh, why is there teeth? Like what is
the cause?
what is that? What? Okay. Anyhow, there's these little ducts. Y'all don't even know that you have them because you can't usually see them. They're right next to the vaginal opening and they're called Bartholin glands. What is the job of the Bartholin glands?
To keep the dirty stuff out?
Not that much.
It's to produce lubrication, right? for
Yes, it
intercourse.
does. It does. It produces lubrication. Now, sometimes these can become very inflamed and you can actually get like an abscess of the Bartholin glands. Oh, look, they did a cartoon. Okay. Google's weird. Yeah, this is weird. Oh, dang. Okay. Yeah, so they can become very, very inflamed and you can get a secondary abscess that you have to go back and either cut out or, oops, did not mean to do that, or you'll have to go and drain it. Okay, so that's Bartholinitis. Oh, this looks like it might show something. Yeah, there's the Bartholin duct. Very, very swollen. You'll see that. I mean, if you felt a big mass down there, you'd probably be like, I am not okay. Right? Yeah. Okay. So that's Bartholinitis. Dyspareunia. What do we say that was?
Painful intercourse.
Painful intercourse. I can always count on you to come through on that one. Fever may or may not happen. Who knows? Transmission. So how's it transmitted? It can be either transmitted like through vaginal sex or through oral sex as well. Cool. Complications. It can go up the cervix into the uterus and end up causing a full out PID, which we know PID causes
Sepsis.
infertility.
Infertility.
Yes, it can lead to, you're right too. It can lead to sepsis. You're not wrong. All right. Diagnosis. So we do a GC screen. Anytime you hear them say we ordered a GC, that means
Gonorrhea. and
Gonorrhea,
chlamydia.
chlamydia.
yes, because they almost always will occur together. Okay.
Right.
Have you heard of the NAT test?
No.
Is that for the HIV?
Yes, there's NAT testing for pretty much everything. So
Okay.
NAT testing just means nucleic acid amplification testing. So it's going to amplify. You do like a normal like GC kind of thing, and it will just amplify it so you can see it better. So there's HIV NAT, there's a chlamydia NAT, there's a gonorrhea NAT. Okay. Do y'all remember the EIA?
Is that the rapid one?
No. Enzyme immunoassay. Do you remember this? Okay.
Mhm.
So you can also do EIAs for lots of different diseases too. So it's different ways that we're going to test for it. The easiest way is a GC. It's a simple swab. You can do it really fast. The lab can get it back to you very, very quickly. Okay. Drugs of choice for chlamydia. Do y'all remember talking about doxycycline? I told you that's a
Yeah.
sexy antibiotic. Even though STDs are obviously not sexy, like any reproductive anything, we use doxy. Okay. You can also use EES, which is y'all are gonna have to freshen up on your antibiotics module.
EES.
Yeah. Erythromycin.
Almost at that. Okay.
Oh, you should have said it. You should have said it. Levofloxacin, which, you know, okay. Azithromycin is usually what we're going to use because that's a Z-Pak, right? Because what you can do when patients come to the ER and they've got PID or they're like saying, oh yeah, it hurts so bad down there, whatever. And we do a pelvic, we find chlamydia and or gonorrhea. We will treat with azithromycin because you can give them 2 of those pills and that's it. They're done with the treatment. Because with STDs, it's very hard to make sure that they finish out their antibiotics and I'm not going to track them, right? So that's what we'll usually treat with. We give them 2 500 milligrams. It makes them kind of sick to their stomach. So we typically will give an antiemetic, but then we know that it's done and they're treated. But they do have to notify their partner because they're just going to keep transmitting it back and forth between each other until they've both been treated. You're not supposed to have sexual intercourse for 7 days because just because you take the azithromycin one time, it still continues to work in your body for the next 5 days. Okay. It is, you do need to notify the health department. It is reportable. They do track it. Have the patient notify their partners, all their partners from the last time they were tested. So the last time they were tested was 2 years ago. You're gonna have to make that very uncomfortable phone call. Okay. And no sex until they complete the treatment. You are going to teach them safe sex practices. Okay. And usually we'll co-treat for gonorrhea. Oh, wait, go back to signs and symptoms because there's a really important one here. This is actually on my boards for the nurse practitioner because people don't know this. Chlamydia actually causes a parahepatitis, like a fake hepatitis. Doesn't mean they have coexisting hepatitis A, B, or C, but a lot of people, if they come in and they say like, oh, I'm having, you know, like a lot of pain in the pelvic area and I'm having right upper quadrant pain, like it hurts up here. I'm like, no, it's chlamydia. They get like liver pain. Okay. And so because of that, we are going to draw LFTs. And there's not a whole lot we can do for the treatment. It's just something that we watch. If we get rid of the chlamydia, obviously the liver will eventually heal itself. Okay. But it's such a random weird sign and symptom and people don't know that. So honestly, anytime I have somebody of childbearing years, and that would be anybody honestly from like 12 to 45, and they come in complaining of right upper quadrant pain and any other symptoms, basically, I'm going to test for STDs. Okay. All right, gonorrhea is the number 2 STD. It is bacterial and it is caused by Neisseria gonorrhea. Again, a gram-negative. Okay, y'all know most of like the reproductive stuff is going to be gram-negative, right? All of your bladder stuff, your UTI, so all of that is going to be gram-negative. All right, it can cause vaginitis. What is vaginitis?
Inflammation of the vagina.
The actual like tube of the vagina. You know that we say vagina to mean like the whole area down there, but really the vagina is only the tube. You know anything like that? Okay.
Yeah.
Urethritis, dysuria, a lot of it, they will have very thick discharge. Sorry, but I'm gonna have to show you because gonorrhea actually will. Chlamydia doesn't usually have discharge, but gonorrhea does. If you don't want to see it, just close your eyes. Okay. It may look like this. Okay. And usually it happens more in males. Oh, this is nice.
Okay.
Well then, okay. So if a dude has penile discharge, it almost always is. So you can see it's going to be gonorrhea. We already know what's going to happen. All right. Let's see. Okay. They can present with painful swollen testicles. Now they'll come in for that. They won't come in for hardly anything else, but if it messes with their testicles, they're like, this is not right. If the girl does have discharge, which usually she doesn't, but if she does, it's going to be green, yellow, and it will come out of the cervix like that picture I showed you where it looked like it was vomiting. Vaginal discharge, dysuria, frequency, or most of the time it is asymptomatic. Okay. How do you get it? You can get it vaginal. You can also get it anal and throat. Now, let me explain this. You can still get chlamydia in your throat, but we do not test for it because you have naturally occurring chlamydia in our like microbiome. So like when I did the child abuse clinic, I always swabbed the kid's throat, but I only tested for gonorrhea because gonorrhea does not exist in the throat naturally. So if that was positive, then I would know that they definitely had gotten gonorrhea from somebody that abused them. But if I tested for chlamydia and they were positive and their abuser wasn't, we would lose the case. But it may be that it was just naturally occurring chlamydia in our system. Okay. Now, babies can get gonorrhea of the eyes from a mother in vaginal birth if she has active gonorrhea. They can also get it in the throat because they're going through the whole vaginal canal. So you need to make sure to aggressively treat any STDs before birth. Okay. But it is not an indication for a C-section. That's really, we're definitely not doing that. Okay. Complications. Gonorrhea, because it is asymptomatic and it usually goes on for so long, it will destroy their fallopian tubes before you even know it. So PID, infertility, tubal abnormalities, strictures. So it makes the fallopian tubes very scarred. And remember, we were talking yesterday about when they're super scarred, you can still get pregnant, but that egg can't pass through that scarred, narrowed, strictured area. And so you'll end up getting a tubal pregnancy or an ectopic pregnancy. Do y'all know much about ectopic pregnancies?
Just that, like, the egg gets implanted not in the uterus.
Yeah, so usually it's going to be in the fallopian tubes. Now, it can occur other places, but in this case, I'm talking specifically about a tubal pregnancy, but it will continue to grow in the fallopian tubes. Now, what's going to eventually happen?
Rupture.
PID.
Going to rupture. Okay, and they will start bleeding out. They'll start hemorrhaging, right? What are the chronic signs and symptoms of an ectopic pregnancy?
Unilateral pain.
Unilateral pelvic pain plus, we've talked about this lots of times before. Yeah.
Hypotension.
They might if they've ruptured, but there's one sign and symptom that's like, if you hear this in a woman, you're like, oh, shoot. It's a referred pain somewhere.
Chest,
shoulder.
shoulder pain.
Shoulder pain. If they have unilateral pelvic pain plus shoulder pain, that usually means a ruptured ectopic pregnancy. Now, if that fallopian tube ruptures, obviously they're going to have to go into surgery and we have to cut out that fallopian tube. So it puts them at increased risk of infertility later because you're still going to alternate ovulation because we didn't take out the ovaries. But that means you're only going to be fertile every other month when that one side that you still have a fallopian tube is happening. Does that make sense?
Yeah.
Okay. So diagnosis, again, we'll do a GC, not EIA. The drug of choice in the ER is going to be ceftriaxone IM ×1. Because if the patient comes into the ER and they have chlamydia, we can give them 2 azithromycin to treat the chlamydia, give them a shot of ceftriaxone, and they're done with treatment.
Okay.
And we know for sure they got treated. If you're treating them at home and you know they're going to be compliant, you can also use Cefoxime, Cipro, or levofloxacin. Okay. Because babies can get gonorrhea in their eyes if mom is positive. That's why we put the erythromycin in the newborn's eyes, every newborn's eyes, right? They get the, when you go into NICU, when you go into the nursery, you'll hear it called eyes and thighs. So they put the erythromycin in their eyes, they do the vitamin K in their thighs. So they'll ask you, have you done eyes and thighs? No, not yet. Can you do it? Okay.
Got it.
Okay.
It is reportable, so you got to notify the health department. You do need to notify your partners, talk to them about safe sex practices. This is included in your yearly checkup so that you should be screened. And this is kind of no sex or alcohol until the partner is treated completely, because you start to drinking and then people start touching. Okay. So you're not supposed to have sex with your partner until they are treated completely as well. Otherwise, you're going to keep switching it back and forth. Okay.
Yes.
All right. Next is syphilis. Syphilis is nasty. What organ does syphilis go to?
The brain.
Yeah.
Hmm.
I do not want to die from an STD of the brain.
Wow.
That is horrifying. Syphilis ran rampant in like the days of yore. And so a lot of people, they thought like they just got, these dudes were getting these mental illnesses, but really it was because they had syphilis so bad that it spread to their brain and they ended up going like psychotically crazy. No big deal.
Okay.
All right. So syphilis is a bacteria and it gets into your body from any type of minor abrasions. And then you have sex and then, you know, it gets through those little abrasions. It comes from something called Treponema pallidum. You do need to know that one really well because it doesn't sound anything like syphilis. So that's probably the one they're going to test on, you know.
Yeah.
All right. What we usually will see in syphilis is a primary chancre. It starts out with one sore on your PP. Sorry, I have to show it to you. Whereas you can compare and contrast that with herpes. Herpes has sores kind of everywhere, right?
Okay.
So
Right.
if there's ever somebody who says, I just have this one blister on my private, red flag, red flag. I mean, if anybody said they had any sores on their private, I probably would not.
Mhm.
Oh, that's on somebody's lip. That's okay. Here's
Wow.
one. That would scare the hell out of anyone. Okay.
Mhm.
Yeah, I'd be like, there is literally a hole. It may not be that intense. It may be something like this. Okay.
Okay.
But they usually will start out with one sore, and that's how it likes to begin. All right. Then after that, you're going to get your secondary signs and symptoms. So they're going to feel really crappy as their body is going through like this massive immune response. Okay. Late stage. All right. So this is where it's going to start to spread. This is obviously if it hasn't been treated, right?
Right.
Mhm.
All right. So you're going to end up with neuro symptoms like ataxia, which is
Drunk walk.
right. Tremors, speech disorders, paresthesias. They will end up going into a full out psychosis. Like they go psychotically crazy. Like there have been a lot of people that were put in mental institutions a long time ago, several hundred years ago. They just thought that they were crazy, but really it could have been treated very easily if they had known that it was syphilis. Okay. It can spread to the heart. They can go into heart failure. I mean, this is ugly. Okay. It's very, very ugly. What is gumus?
I'm not sure.
Is
Okay.
it something that happens? Like a swollen,
It is something that happens. Yes.
it's like a swollen, not like nodule or something.
It's like a nodule. Yeah. Looks like a little mass or a little tumor. Let me see if I can find it. And they'll start appearing. It doesn't just have to be on the private parts. They can start appearing kind of everywhere. Here's one. I mean, you wouldn't see this on someone's leg and think probably syphilis. You know what I mean?
So
So
it can have the other parts of the body?
Yeah, that's
Wow.
somebody's nipple. That's scary as hell. This ate somebody's face off. Okay. I mean, these are very intense, obviously, but like this is an example. It's like a growth here. So yeah, so it can occur anywhere. Okay.
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 Stop it.
Don't get this one. All right. How do you get it? You can get it through sharing needles. You can get it through any type of sex. It can be congenital, so it can pass from mom to baby. And it is very often that they also have HIV along with the syphilis. Okay.
Okay.
All right, complications. They can end up dying from no big deal, just a massive aneurysm or heart failure or neurosyphilis where it will eat their brain. When you do a autopsy on somebody who died of syphilis, it looks like Swiss cheese. But don't get this one. Protect yourselves, okay? I'm glad we're doing this on a Friday night because y'all probably about to go out or something, just so you know what you're up against here. Okay, what is tabes dorsalis?
The foot? No.
It's not the foot.
It's not what?
A foot.
A foot? Oh,
Yeah.
because of dorsalis. Yeah, that would have made more sense. But the foot is the reason we use that word is because it's dorsalis pedis, right? Which is foot.
The
No.
foot. Oh, okay. Okay. The back.
Okay, yeah.
Does it have something to do with the brain?
Uh-huh.
Back of the brain.
What
Back of the brain.
did you say? Back of the brain?
Yeah.
Oh. What's in
nerves?
The
yeah,
eyes in the
it
back.
eats away your nerves. It eats
Oh.
away your nerves. So they will end up getting progressive ataxia, so they can't even walk anymore, and they'll get a severe nerve pain. Okay.
Okay.
Not a good day to have an STD. All right, so we are going to do either a VDRL or an RPR. What is the RPR? Cool. Okay, so RPR is the blood test that we will do for syphilis. It's called a
Okay.
rapid plasmin reagent.
Okay.
They should do this at all your well visits. When they draw your blood for HIV and things like that, they should also do an RPR. An RPR is a blood test for syphilis. What is a VDRO? It's another lab test for syphilis. Want to know what it stands for? It's so stupid. Venereal disease research lab test.
Venereal.
Yeah, STDs used to be called venereal diseases.
Okay.
That means like private parts.
Okay.
Okay. So we're going to treat it with penicillin G. You can get an injection. or you can treat it obvi with doxycycline,
Mhm.
or tetracycline is another option. You need to test for HIV because these two often occur together. You do need to notify the partner. And then we are going to repeat test because this thing will eat your brain. You know, we should probably retest it, make sure it went away. We do it at 3 months, 6 months, 12 months. It is reportable to the health department. And then of course you're going to go over safe sex practices and tell them to report any neurosymptoms. It's a lot more common than you think.
Wow.
All right. HSV2. What is that?
Herpes.
What?
Herpes.
Yeah, it's the herpes. Why you gotta yell herpes at me? All right, so it is HSV2. Where is HSV1?
Your mouth.
Yeah, those are cold sores, right?
Mhm.
Now, when you draw a blood test that you get at your normal well woman, it will say HSV1 or HSV2. You need to be very careful how you explain this to patients. Okay, because it's gonna say, hi, your HSV screen came back positive. Man, what? You just say, like, we did a herpes screen. And you do not have genital herpes, like that came back negative. Be very clear on that, and then say, but we did see that you have a virus that can cause cold sores. Do you get any cold sores? Okay. You'll know once you get the herpes simplex virus, it will never leave you, right? You will have
I've
it
heard that.
forever, even if you are asymptomatic and you've never had symptoms. If you do have symptoms, it can cause burning, tingling, these vesicular lesions. What is a vesicle?
It has fluid inside of it.
Yeah, it's a fluid-filled blister. Ulcerations, and they crust over, kind of like chickenpox does, you know, like they get really vesicular, they get fluid filled, they pop and they crust.
Yes.
Very painful. Some patients have systemic symptoms too, like fever, headache, malaise. They may get swollen lymph nodes in the inguinal area. Dysuria, urethritis, cystitis, like it burns, and it burns when they pee because it hits those sores that are open and your urine is very acidic. Do y'all know what herpes looks like? Do I need to show it to you?
Is it similar to the cold sores?
I'll show it to you.
Okay.
I know nobody wanted to ask because, you know, it's quite weird. Yeah, let me see it. All right, I will show it to you. This is probably like the number one thing that we have people lie about, because if they're not symptomatic, oh, they're not going to show anybody. So these are all like, oh, just so you know too, you can get herpes simplex 1 in your genital area. If somebody has a cold sore and then performs oral sex on you, you can get herpes simplex 1 in the vaginal area. And when babies, what the heck is that? Oh, that's an eye. I thought that was a baby coming out. I was like, what is wrong with that child? Yeah, if babies get a herpes infection, it a lot of times is fatal. Okay, they're not gonna let me see it, which is fine. No, I think they're censoring me. That's fine. Oh, here it is on a nail. These are already crusted over, so those don't even look that bad. That's like after it's already been there for a while. This is probably more likely. Very painful. And you can see, since it's herpetic, always occurs in clusters. Do you know that?
What occurs in clusters?
Herpetic, any kind of herpetic rashes will occur in clusters.
Okay.
To do that. Well, that's a up close and personal. Like here. Okay, I'm not good at this. I'm sorry. I think I pressed the wrong thing. Okay, so you can see like they occur in clusters. Here's a big cluster, here's a big cluster.
Okay.
Okay, but they will ulcerate, and like you can see, like these are like ulcers. And so if you peed, that would hurt very badly. Yeah, because it's gonna hit on the outside. Who's this? Okay. Moving on. How do you get it? It is sexually transmitted, obvi, and you can transmit it from baby or mom to baby in a vaginal birth. If she has active lesions, she would have to have active lesions. If mom has active lesions, we will section that baby, because if baby gets herpes, it almost always is a death sentence. Okay, it is very hard to treat in babies because they don't really present with symptoms until it's like too late to treat, and you can't like give them antibiotics, right? And by the time you actually catch it, the antivirals usually aren't effective, because what do you know about antivirals?
You have to do it started like very early.
Yes.
Like,
And so by that point, it's like, it's too late. Okay. HSV keratitis. What is this?
Keratitis. That on the skin?
Yeah.
Or nails?
Oops, I didn't mean to do that. It's
Your eye?
Yeah. Do you want to get herpes in your eye?
No.
We probably don't want to get herpes anywhere. Okay. However, Yeah, you can get herpetic infections in the eye, and this is very, very bad.
This is like a clouding on the lens or
Like,
something.
look at this. No, this one actually, I don't know why it did that. I think because theirs is pretty severe, because keratitis will increase the thickness too. But that one, I mean, that's very severe. I've never seen anything like that. This one, obviously, very severe. But keratitis is going to keep adding like layers onto this one. Is pretty bad too.
Okay.
But yeah, getting herpes in your eye is not your best day either. Yeah. All right. So when patients get an outbreak, because it is herpetic, meaning it occurs along the nerves. That's why you see things in clusters, because it occurs like along those little dermatomes. You know what I'm talking about? So they will feel the herpes lesions before they see them, because the nerves will already start tingling. So as soon as they start feeling tingling, they need to go ahead and start taking, they usually will take acyclovir, and you can just give them like a standing prescription for them to go pick up whenever they have an outbreak. But if they need to start taking it before they see active lesions, they'll know, because it'll start burning and tingling before the lesions even come out. Shingles does the same thing. What else? Cold sores do the same thing. They'll feel it before they see it. All right. So in order to diagnose, we are going to do HSV serology. Serology means
Blood test.
a blood test. So there's a blood test we can use for HSV1, HSV2. And then the treatment obviously is antivirals, acyclovir, valacyclovir, famciclovir. You can transmit it even if you're asymptomatic. So if you have herpes, you can transmit it all the time. Now your partner is going to have to decide whether it is, you know, if they're comfortable enough to have sex with you, even if you're asymptomatic, because they can still get it. Okay. They do have outbreaks. Okay. You do definitely need to notify your partner. It is really gross to just have sex with people and not tell them because you don't have an outbreak and they wouldn't know. That's gross. It is not reportable. Okay. So it's not one that you have to call and report. Because really there would be nothing that we could do to prevent HSV. It's a virus. You know what I mean? Like, yes, you can wear condoms that will decrease your risk, but the herpes simplex virus occurs in the vaginal secretions. So even if they wear a condom, those vaginal secretions are getting all over a dude's private area, right? So the condom really isn't even enough in that case. Do y'all know what I mean by that?
Yeah.
Okay, because I don't want to go any further onto it, so I'm glad that you understand. You will tell them to wear white cotton panties. Remember, those are making a comeback, okay, because they're absorbable and they're not irritating. Do good hygiene, which means do not wash it with soap. You rinse off with water and let it air dry. If it is very painful or itching, take a hair dryer on a cool setting and go to town. What? Okay.
Wow,
and you're
okay.
going to do that. Yeah. After you bathe, you need to dry it really well too before you put on the cotton panties. You can do a vino or what they call Burroughs baths. You can get them over the counter, and it's just a very soothing bath that you're going to sit in to help soothe those ulcers. We do want to encourage condoms, but like I said, that's not really enough to completely prevent HSV2. Got it?
Got it.
All right. Next is genital warts. Have y'all seen these before? Okay, you all learned today. Things like I've seen it. This is another one that cannot be completely protected just by condoms alone. Because, you know, when you're switching stuff back and forth, it can get, oh, I didn't mean to do that. It can get everywhere. A lot of times the warts will hide like underneath the scrotum where dudes aren't like pulling up their scrotum and looking in the mirror. But because secretions kind of get everywhere, they will hide in different places and they may not know. This is what they look like. Okay. They're like in little cluster forms too. And they can occur anywhere in the genital area. Oh, I don't know why I did that. Let's see if I can find a email one. You can also get these in your throat. So if somebody had genital warts and you did not know it, because they like to be well hidden, and you have oral sex, they can get into your throat. This has happened. Y'all know what genital warts is from?
No.
Oh. How do you get them?
Sexually.
Well, yes, but what causes them? Oh, this is pretty severe. That's all up inside. That's all warts.
Dang.
That she obviously also has some kind of STD along with it, but it's a virus that causes it, right? Warts are a virus. Any type of wart, no matter where you get it. You get a planter's wart, you get one on your finger. Those are all warts or viruses. What's the most common virus that causes
HPV?
PV? So you get genital warts typically from HPV. They are called condylomata acuminata. Sounds like Hakuna Matata. They are pink flesh colored. I showed you those. Sometimes they itch, but they don't bother anybody at all. But pregnancy will worsen them if you already have it, and they can be transmitted to baby. There is a case that we had. How do I say this? Okay. Mom had genital warts, but you couldn't really see from the outside because, like I said, like they try to hide, and they could be all up inside. Like y'all just saw that too, right? And so when baby went through birth canal, she had a vaginal birth, the baby got the HPV virus, and the warts started growing in his throat. And so he started noticing like baby's having respiratory distress, and he was getting stridor, and we're like, what the hell? So they went and scoped him. They went and did a bronchoscope and found warts all down the throat. Now you can burn them, which they did over and over again, but they just kept growing back, and they eventually had to trach him. So this can be very, very bad. So you want to make sure that you get them treated, especially before pregnancy, because pregnancy is going to make them worse for whatever reason. Complications, if you get genital warts, you're more likely to get cervical cancer or vulvar cancer, and that's because of the HPV virus. Okay. All right, diagnose, you can do an HPV DNA test to see if you actually have HPV. It's a blood test that you can do. Now I did put this underneath. I put a wavy line so you would know that this is not testing, but I just wanted to let you know these are ways that you can treat them. You can do cryotherapy, which is
Cold, freeze them off.
Freeze them off. You can do laser therapy where you laser them off, or you can apply liquid nitro and it basically like burns them off. Okay, but they can still come back if you still have the HPV virus. And like 75% of women have some type of HPV virus. It's just not the certain strand that causes genital warts. Okay. You can also do an ablation. What's an ablation?
Like burning off.
Yeah, we can burn them. It's just a different way to burn them off. It's not like a laser way of burning them off. There is something called a TCA, BCA acid. And so they can apply this acid directly to them. And again, it will kind of burn it with acid. Same with the pedophile and ricin, sorry. Podophylox and Aldera, those are creams that we can apply that you can prescribe them and the patient can go home with them and they apply those creams. Make sure you wash your hands afterwards. And it will eventually get rid of the genital warts, but it takes a lot longer. And so you have to make sure that they are compliant. Okay. We do recommend some people recommend the HPV vaccine. Okay. Safe sex practices, but like I said, you can't really prevent genital warts if somebody has them because it's just through the vaginal secretions and that can go pretty much anywhere. It is not reportable, but you do need to notify your partner so they can go get tested and treated. And then just do very good hygiene down there because it's just irritating kind of down there. So you want to make sure you keep everything clean and dry. Okie doke.
Got it.
Okay. All right. Did I do these? What are these? Nope. All right. Are y'all hanging in? Are you doing okay?
Yeah.
Okay. I give you a break, but I did not have time to. I'm so sorry. All right. So HPV, we just talked about this. So most of this is going to be a repeat, but I just wanted to mention like straight out HPV because it can cause more than just genital warts, right? So we do not test for HPV anymore because they would screen everybody or test everybody. And then 75% of women would come back positive and everybody went into a massive panic. Oh my God, I have HPV. Am I going to get cancer? Yada, yada. So they do not test for it anymore. Okay.
Okay.
Most of the time, if you have HPV, it's totally asymptomatic. Like most people have, and they don't even know it. Your body will eventually clear it. There are some strains of HPV that are more dangerous than others, right? Those are the ones that can end up causing
Cancer, the warts.
Cancer or warts. Yes. They may have chronic vaginal discharge, but it doesn't usually smell bad. It's not usually like horrifying, but they're just like, man, I just have like a lot of vag discharge. Post-coital bleeding. What does that mean? What is coitus?
Bleeding?
Yeah, coitus means sex. I hate that word. It sounds gross. Did you perform the coitus? So they may bleed after sex, okay, or they may itch a little bit, you know, maybe have dyspareunia, maybe a little painful sex. And y'all know it can grow in the throat from oral sex. So that's why we always want to ask what type of sexual practices they're participating in so I know what to check for. Okay. They are now starting to vaccinate girls for HPV at age 9. Which is before sexual contact, hopefully. That's gross. Transmission. vaginal, anal, and oral. You know, you can get anal warts as well. That is not a good day. Okay. Many will resolve on their own. Some of them will not. It does put you at a huge likelihood of getting cervical cancer if they are untreated. If the growths, like if you do have genital warts and they are very large, we will do a C-section. So that way the baby, there's no likelihood of baby getting it, or decreased likelihood. I shouldn't say no likelihood, decreased likelihood. All right, diagnosis, we can do a viral screening or HPV DNA. Those are a blood test, or it may show up on the pap smear. Okay. So on a pap, it would show up as an abnormal pap, or like, they may say it's carcinoma in situ, or they may say that there's cervical dysplasia. 99% of the time that's from an HPV infection. Okay.
Okay.
All right. The HPV or warts may get worse during pregnancy. We talked about that. And then I gave y'all all of the stuff already, like white cotton panties, cool air hair dryer. Make sure you get your annual pap. And then there's 2 types of HPV vaccine, Cervarix and Gardasil, right? Each one of those vaccinates against different strands. So you got to just kind of take a guess and pick one and hope that's not the one you have, because there's millions of strands of HPV. So what is the likelihood that, you know, you're going to get one of those 13 that they put in there and that's the one that would cause a problem? I don't know. That's a big what if. Do you understand HPV?
Yes.
Yeah.
Do y'all need me to go over hepatitis A, B, C?
No.
We've done this like a bunch of times. Yeah.
Yeah.
Are y'all good with it?
Yes.
Okay. Will y'all tell me if you're not good with it?
Yes.
Yeah.
Okay. All right. Oh, whoops. Okay. Do we need to go over HIV?
No.
Okay. Please make sure you know your risk factors. I think everything else I've gone over with y'all. It's the same as we've done in patho. It's the same as we did in adult 2. Nothing has changed. Let's see. PID? Do we need to go over PID?
Maybe a little bit.
Yeah, let's do it. All right. So cause, it's all the things we've already talked about today, right? You can get pelvic inflammatory disease from gonorrhea. What is C. trachomatis?
Syphilis?
I thought that was the other word for chlamydia.
Yeah.
Oh, chlamydia.
I wrote it twice for some reason. I don't really know why. Oh, probably because I gave you the fancy word than the actual word.
Oh.
Yeah, that's what I did. Okay, but yeah, it can be caused from pretty much any STDs, right? The most common that we see is chlamydia and gonorrhea, and that's the most common that can lead to PID, mostly because those are asymptomatic, and so you won't know that you have it, and it will continue to travel up to PID. So it spreads from the vagina to the reproductive tract, usually after menses. Why is it more common right after you have your period? Doesn't your cervix open a little bit during your period to allow the,
Yeah.
so then it can travel? Yeah. All right. It can also happen after a miscarriage, again, because your cervix is
Open.
after an abortion, because your cervix was
Open.
open and they went up in there. So it's very high likelihood after abortion. Any type of pelvic surgery, or if you've just had a baby because your cervix is
Open.
yeah. Signs and symptoms of PID. It is a rough disease. I've seen people come in super acutely ill, like septic looking. They look bad when they come in. Dyspareunia. What's pyosalpinx? That's a wild word.
Does it have to do with the fallopian tube?
Yes.
That's all I got.
Okay.
Fever?
Fever of the fallopian tubes.
Yeah.
It's pyosalpinx. Y'all think of like pyuria.
Pus?
Yeah.
That's like, okay.
Pus in the
Fallopian tube.
Fallopian tube.
yes. Severe pelvic pain, fever, chills, nausea, vomiting, like they are ill appearing. Okay. Some of them have irregular bleeding or spotting. Some of them may have UTI like symptoms, because you know most of these STDs will cause dysuria, right? Lower abdominal tenderness. What is adnexal tenderness?
Adnexal.
So you know we do a bimanual exam? A bimanual exam where you put your fingers in and then you palpate on the outside.
Yes.
So usually where the ovaries and the fallopian tubes are, that will feel very like they're going to scream and come off the table. You
Okay.
can do pelvic on PID. I do not do pelvics if I think that they have PID. I will do a speculum, but I'm not digging around in there. I have to do a speculum because I have to test for STDs, but it's very, very painful to do that to them. Risk factors for PID: young with multiple partners, if they've had lots of new partners, if they've ever had an STD before, and if they have an IUD with more than one partner. Because remember, the IUDs, they have a string that comes down, right? And then
Yes.
the STD can travel up that string and right into the uterus and then the fallopian tubes. Yeah.
Yes.
Okay. Complications: salpingitis. What is salpingitis?
Inflammation of the fallopian tube.
You got it. Endometritis.
Inflammation of the
Endometrium.
endometrium.
Yeah. Ectopic pregnancies.
And
Signs and
I-
symptoms. Huh?
Uh-oh. Never mind.
What'd you say?
Nothing.
What's the chronicle sign and symptom of an ectopic?
Shoulder pain and unilateral pain.
Unilateral wear pain.
Pelvic.
Pelvic pain.
Pelvic pain. If they get the shoulder pain, that usually means it's already ruptured. They may just have chronic pelvic pain or pelvic adhesions. Y'all know what adhesions are?
Like scarring.
But it attaches to the abdominal muscle.
It's like scar tissue.
Yes. But when they like move and turn, it's very painful because that scar tissue is pulling on their abdominal muscle. Okay. Tubo-ovarian abscess. So you could either have an abscess in the ovaries and the fallopian tubes or where they meet. It can lead to permanent infertility because it will scar your fallopian tubes. Do you understand?
Yes.
All right. Diagnosis. We will see a high ESRs, high CRP, high white blood cell. Yeah. Very high fever. Usually they have a positive GC. Usually. But I'm still going to test for all of the other STDs because those can coexist with them. Okay. Or you can make a clinical diagnosis. Sometimes I really want to know what they have, to be honest. But sometimes you can just tell by the presentation and they'll just treat them for chlamydia and gonorrhea. So what we usually will do, because y'all know that trichomonas can cause PID, like all these different diseases can cause PID. So we're going to give ceftriaxone because I can give that as a shot. Okay. Plus doxycycline, plus or minus, and they usually will add metronidazole if they think maybe it's a trick issue too. Okay, so it's going to cover pretty much everything. Your other option is to do cefodotan or cefoxitin plus doxycycline. Doxycycline will always be included because we know we do that for everything reproductive. Those are the two biggest options that you're going to see. Pregnant women have to be hospitalized. How come?
Like, because they need a lot of antibiotics.
Yes, because why though? Why are we going to put them on
the
IV
rupture?
antibiotics? Huh?
The rupture.
The preterm labor. Their
Oh.
likelihood of going into preterm labor is very high. So I don't want to send them home with some oral antibiotics and just hope they take them. Right?
Right.
Right.
Okay. So nursing care, we're going to do prevention counseling. That's later, obviously, after you treat them. And please watch for sepsis because that can happen. So what lab test am I going to run?
Lactic acid.
Lactic acid, and we're going to do blood cultures, right?
Mhm.
If they're in the hospital, we're putting them on bed rest and semi-Fowlers, giving them lots of analgesics. During the acute disease, you are not supposed to be digging in there for a pelvic because you're just pushing that stuff right up in there.
Mhm.
That's why sometimes they won't perform a pelvic and they'll just do a clinical diagnosis at first. Okay. They are
Okay.
not supposed to have any sexual intercourse until treatment is complete. They're not feeling like having sex anyway. Okay. After they feel better, then you'll start doing the prevention counseling and talking about making sure they use condoms and getting screened and limit their sexual partners and things like that. Okie doke.
Alrighty.
Questions, comments?
No.
I think that's it.
Oh, really?
Yeah. Because y'all said you want to do HIV and hepatitis on your own. Yeah.
Yes.
Okay. You're like, yes, we don't want to do it again. All right. Questions for me.
No.
So if you know everything on those charts, you should do absolutely beautiful on this module.
Can I get the link to those charts, please?
Yeah. I'm going to get all that stuff sent over.
All right. Thank you.
Okay. Y'all have a good Friday night. Enjoy your
Thank
dinner.
you.
Get some cottage cheese and strawberries. Okay.
So,
Okay. Bye, y'all.
all right. Bye.